Do you know that coccidiosis causes close to $3 billion worth of loss in the poultry industry? Apart from decreased weight, it can also lead to loss of birds, and this greatly affects production and profit. So thank you so much once again for joining in. Please don't forget to like, to share, to comment, and to subscribe. Tell a friend to tell a friend. I'm by name Dr. Tom Wealth, and I'll be bringing you a lot of insights as regards how to recognize this disease, how to manage it, how this disease spreads, and what to do if you encounter some of the signs that I'll be discussing with you on your farm. Now, you might ask, what causes coccidiosis? Or when you hear the word coccidiosis, what should come to your mind? First, I would like to tell you what should come to your mind when you hear the word coccidiosis. When you hear cocci or coccidiosis, you should not forget, always remember, it is accompanied with bloody diarrhea or bloody feces. And in pidgin, what they call blood in the feces or blood when they stain shit. Hope that is clear. So, what are the causes? Now, it's caused by two organisms called Emeria and Isospora. And these organisms, they live in the gut. By gut, I mean they live in the stomach and the intestine. What do they do when they get there? When they get to the gut and the intestine, they cause a lot of sloughing of the epithelium, and the major cause of the reddish poo is because of the ulceration they cause in the stomach. By ulceration, what do I mean? There's a big wound there that they cause by boring into the epithelium of the intestine, and this is the reason why you see blood-stained feces. So now, what are the telltale signs of coccidiosis in your farm? Lest I forget, all those epithelium that I was talking about, please pardon me. Now let me come down to what everybody can understand. Now, when you talk about coccidiosis in your farm, the first thing you will notice is that there's a change from a solid formed feces to a semi-solid stroke watery feces. And the coloration changes from what we normally see as ash with specks of urine deposits to brownish, brownish coloration of the feces, a semi-solid feces with bubbles in it. Pay attention. Brownish feces with bubbles in it is the first telltale sign that your animals are beginning to develop symptoms of coccidiosis. Now, it is this brownish stained feces that becomes reddish over time within a few days. So, whenever you see red stained feces, before you rush to go and buy antibiotics or antibacterial, calm down and know that it might also be an antiprotozoal infection. Now, you would want to ask, how is this disease transmitted from bird to bird or from flock to flock or from farm to farm? The reason the transmission is quite easy or rampant is because of how birds become infected with this disease. Now, I told you that, when you hear coccidiosis, you say blood-stained feces. But there are other signs, general signs like the bird, moving away from the general flock, isolating herself. Another sign is that you would call it unthriftiness or lethargy, weakness. Unthriftiness means you just look at the feather, you see that it has a roughened coat, roughened feather, and the bird is lethargic or weak and tired. Now, for transmission, in medicine, there's something we call transmitted through the fecal oral route. That is, by fecal, I mean from feces to the mouth. That is from the bum bum to the mouth. Now, when we're talking about fecal oral route, it means the bird can only get this disease by what they eat and drink. If the water is contaminated with a feces that has the antigen or that has the parasite, the bird will come down. If the feed comes in contact with feces that has this parasite, the bird will come down. So the next question would be, if this disease is as deadly as this and it can spread from flock to flock, by just eating and drinking, how do I prevent this disease? We can prevent this disease, by following some steps. The very first step, which people do not think about, is vaccination. Yes, coccidiosis as a disease has a vaccine, but people do not pay attention to that. Why? They feel it's expensive. Not knowing that if you, for example, vaccinate your birds as early as the first 15 days of life, that vaccine that you gave them, will be able to carry the birds for as long as 60 weeks of life. Now, if for example the bird, speaking in Nigerian terms now, if for example for 1,000 birds, coccidia vaccines are sold for 60 to 80,000 naira, you know, what will be the cost of treating cocci in 1,000 birds for 1 year if you treat them once every 2 months? Anti-coccidia drugs range from 40,000 to 60,000 depending on the one you want to purchase. And if you are to buy them every 2 months, it's far like you would have spent 10 times the amount you would have used to vaccinate your flock. So I've talked about vaccination. Please always include coccidia vaccines in your vaccination programs. The next thing is hygiene. Hygiene is very important. Why is hygiene important? Like I told you, if your pipes are dirty or they are contaminated with feces, your birds must have cocci. It's not a bad prophecy. It is certain to happen. Now, if your feeders are dirty too or contaminated with feces, my brother, go and be treating cocci. Now, what is the best way to control this disease? I've actually hinted you on one of the ways to control it, which is engaging the best hygiene practices. Now, for hygiene, it starts with a proper biosecurity system by decontaminating people's feet and ensuring that your farm staffs and everybody that wants to enter your pen wash their hands before entering. Why do I say this? I told you earlier when we started that this coccidiosis is not just limited to poultry, it also affects other livestock and humans too. So humans can be carriers, cattle can be carriers, and a whole lot of other animals can be carriers. When cattle graze around your farm and you coming into your farm, you have used your leg to step on an infected poo. You can bring it into your farm and without disinfecting your leg, you would have passed it onto the flocks. So how do we treat this disease? Instead of going to buy antibacterial or what is commonly known as antibiotics, think again. When you see bloody diarrhea, please, the first culprit for bloody diarrhea is cocci. Although other diseases can cause it, like necrotic enteritis, which is rare, once you are not changing feeds often, like using different commercial feeds on your flock, you would naturally not have issues with necrotic enteritis. So whenever you are seeing a bloody diarrhea, instead of buying antibiotics or specifically antibacterial, think again and get antiprotozoan drugs. So for the tests that we carry out as veterinarians, when a veterinarian comes to your farm, we take fecal samples. The feces we take would help us when we do fecal flotation. We're able to see the oocysts, in the feces. So it's this oocyst that we see that helps us confirm if your flock is infected with coccidia or worms or all of that that is found in the feces. When you have gone through this video, there are some things I would want you not to forget. The first thing is when you hear coccidiosis, what did I say is synonymous with bloody diarrhea? So instead of running for antibiotics, make sure you have ruled out possible cause, which is the Emeria and the Isospora, culprits for coccidiosis. Another thing I want you to not forget is that how it is transmitted. It is transmitted via what they eat and via what they drink. And once what they eat and what they drink is contaminated with feces, there's no two ways about it. Those birds will come down with cocci. Then what else is important? Like I told you, I said maintain strict hygiene and biosecurity procedures. When you do this, I assure you, you'll be in profit and you treat less and you stay profitable. Yeah, so thank you. I think we've come to the end of today's episode. Please, if you found this helpful, don't forget to like, subscribe, share, and to drop a comment. We would like to hear from you. And don't forget also to turn on the notification just in case more videos will be coming in so that you'll be the first to know and to benefit from the insights we'll be sharing. Thank you so much for tuning in. See you again next week.